morning to all of you. Thank you for joining us for today's webinar. I am Mrs. Kritika, Associate Professor, Nandha College of Pharmacy, Erode. So today we are presenting a national webinar on the topic of COVID-19 and diabetes, present by our resource person, Dr. R.VADIVELAN, Professor, Department of Pharmacology, JSS College of Pharmacy, OOTY. On behalf of our institution, I feel grateful to invite our participants from various institutions on this fruitful virtual platform. So, I assure that there is no need of introduction for our resource person who have an intellectual personality. So today's webinar is quite interesting with the topic COVID-19 and diabetes. It should be more informative for us in this pandemic condition. And being a pharmacologist, he will feed us more enough to update our knowledge. We feel proud, you sir, by connecting with this virtual platform today. And of course, we would like to express our gratitude to Thiru Shanmugan, our chairman, and our secretaries Thiru S. Nandakumar Pratip and Thiru S. Tirumurthy, Nandha Educational Trust. Without their motivation and support, organizing this webinar is impossible in this pandemic condition too. So let us welcome our Honorable and beloved Principal, Dr. T. Shivakumar, Nandha College of Pharmacy. If your actions inspire others to dream more, learn more, do more, and become more, you are a leader, sir. So as per this quote, he is a great inspiration for all of us. I would like to request you, sir, to deliver welcome address and few words to this webinar. Please, sir.
Thank you, Kritika,
Thank you,
for a
sir.
wonderful motivational speech before me. A pleasant morning to everyone and warm welcome to our resource person, Dr. R. Vadivelan, Professor, Department of Pharmacology, JSS College of Pharmacy, Nilgiris, to deliver the topic on COVID-19 and diabetes on the national webinar organized by Nandha College of Pharmacy, Erode. His charming personality and more interaction with us in the many days. Recently also interacted at some international conference with us and more supportive to Nandha College of Pharmacy, one of the knowledgeable pharmacologists in and around South India, even India. And I feel grateful to have you in this online conference and more thankful to you for acknowledge our invitation and for your kind support in this pandemic situation. Welcome, sir. For this.
Thank you, sir. Thanks.
Yeah. Of course, today's topic is more interesting, relevant to our current situation. There is a bi-directional relationship between COVID-19 and diabetes. On the other hand, diabetes is associated with an increased risk of COVID-19 because new onset diabetes and severe metabolic complications of pre-existing diabetes, including diabetic ketoacidosis and hyperosmolarity, for which exceptionally high dose of insulin are warranted, have been observed in the patient with COVID-19. This manifestation of diabetes pose challenge in clinical management and success to a complex pathophysiology of COVID-19 related diabetes. I hope you all will understand the theme of this webinar and will enhance it for better future. I ensure you all that this conference will be fruitful one for each and everybody in every aspect. I feel happy to have delegates from various institutions such as Andrews and Department of Health, Sirigo City, Philippines, and L. Penimental, Philippines, Dr. Kamal Kishore, MJP, Rohil Gandhi University, Bareilly, Uttar Pradesh, and Dr. Dinesh, College of Pharmacy, Soniapet, Haryana, and Sri Lakshmi Narayana Institute, Dr. Abarna also joined with us. Janmeer Kaur from the industry, Torrent Pharmaceutical Limited, Himachal Pradesh. Others from Madhya Pradesh and Uttar Pradesh, Andhra Pradesh, Telangana, Kerala, and Maharashtra. Even more institutes from Tamil Nadu joined with more cooperation of this particular seminar. I would also like to thank our chairman, V. Shanmugam, equally to our secretary of Nandha Educational Institute, S. Nandakumar Pradeep, and S. Tirumurthy for this wonderful and moral support for encouraging a successful. My gratitude to our administrative officer, Krishnamurthy sir, Nandha College of Pharmacy, Erode. And similarly, I thank my team and Dr. Jagadishwaran, who coordinate this today's seminar, Dr. Vadivelan, and interacted with many people. And also equally, Kritika, Associate Professor, and Dr. Hamlata and Kalpana Gladys for wonderful work for the website promotional and other associate this seminar. And interesting and young, energetic, our administrative officer, Medical College, Ayurveda Siddha, Apollo James, and for his cooperation, hard work and their cooperation on and off this screen. And also I thankful Vice Principal, Department of Pharmacology, Dr. Sinkotuvelu and Aja Sharif and Lalita and equally other staff members for this organizing wonderful seminar. Thank you, one and all. Thank you.
Thank you, sir. Thank you for your kind and warm welcome and lovable gratitude to each and everyone over here, and your motivational words towards the participants also. Thank you so much, sir.
Thank you, madam.
Yes, sir. Now we can go for a presentation. So before that, there is an, as usual, important announcement for our delegates. Kindly follow the session. You are invited to discuss your valuable suggestion and your doubts. Should we enter into our question answer box or in a chat box on your control panel? It will discuss with our resource person during the questionnaire session. Okay, so now we can invite Mr. Apollo James, Professor, Department of Pharmacy Practice, Nandha College of Pharmacy, to introduce our resource person, Dr. Vadivelan. Please, sir.
Good morning, everyone. On behalf of Nandha College of Pharmacy, I'm very happy to introduce our today's resource person, Dr. R. Vadivelan, Professor, Department of Pharmacology, Education and Research, Rocklands, Udagamandalam, Nilgiris. Dr. R. Vadivelan completed his graduation in pharmacy and post-graduation in specialization of pharmacology from the Dr. Tamilnadu MGR Medical University, Chennai, in the year 2000 and 2002. He has been awarded PhD in Pharmaceutical Sciences from JSS University, Mysore in 2013 and also recognized as FIC from ICS Kolkata. Completed FELASA accredited CCLAS course at Tanuvas, Chennai. He has got 18 years professional experience and area of research is metabolic disorders and alternatives to animal testing. Received APP Best Teacher Award during 2019 at APP 8th Annual Conventional and 4th Indo-US Conference at JSS College of Pharmacy, OOTY, for his outstanding academic contributions. He received various grants from ICMR, DST, ACRB, and JSSAHER for conducting seminars and workshops on topics alternatives to animal testing in drug discovery, FURARS and CAL techniques. 2013, 2015, and 2017 as a convener and organizing secretary and NAM and S&T Center Research Training Fellowship for Developing Country Scientist Award of Fellowship for 2015 to 16, received fund for improvement of S&T infrastructure in universities and higher educational institutions. FIST, DST New Delhi, 2014 to 2019. He has made 26 presentations, published 66 national and international research publications, and authored one book. As resource person, delivered more than 24 lectures in various institutions in the areas of preclinical pharmacology. He had guided 27 PG students and 2 PhD scholars. Present President of Indian Pharmaceutical Association, Nilgiris local branch, and life membership of IPHA, IHPA, IPA, LAZA, and APP, and other significant contributions. Or principal investigator, carried out various preclinical studies. With this brief introduction, I am handing over the session to Dr. R.VADIVELAN. Now the screen is yours. Please, sir.
Yeah. Before starting my session, first I would like to thank my beloved well-wisher and principal, Nandha College of Pharmacy, Sivakumar sir, for your blessings and updating about my knowledge. So still I am a student of you, and I am trying to gather my knowledge, and I'm learning. Definitely, I'll make the session fruitful with your blessings, no doubt in it. And next, I'd like to thank our chairman and young secretaries of Nandha institutions for giving me the opportunity. And also, I've been past few years with associations with Nandha College of Pharmacy for international and national conferences. And next, I would like to thank the team, webinar team, who have interacted with me from yesterday and last week, and Mr. Jagadish also, and giving a small introduction about me, Apollo James and Dr. Kritika. And I would like to thank my friend, the HOD of Pharmacology, Senkutuvel sir also, who will be listening to this session. So let me make it short and let me go to the topic. Let me say, as sir mentioned, why I have selected this topic, COVID-19 and diabetes. See, if you see nowadays, every morning, just half an hour back, 1 hour back, we are getting plenty of updates regarding the drugs, disease, and vaccines for the management of COVID. So still now there is no treatment or any pharmacotherapy for COVID-19. So we are just going with the management. Let me discuss with a small topic, what is the background, what is the pathophysiology, and then what are the various management of vaccines and drugs available today, up to date now, in India and globally. And in case with a diabetes patient, how we are going to manage in the situation of COVID-19. So this is a small topic what I'm going to discuss. Plenty of information is being collected, and day by day we have to collect also. So whatever the information which I have collected, I can put a disclaimer. So everything is being collected from WHO, CDC, Ministry of Health and Family Welfare. So all these updates are directly collected from these sources and also from the International Diabetes Federation. So nothing is of my own. Everything is what I'm going to express from those sources to the delegates. So to go with my topic, I think the host disabled. Apollo James.
Yes, sir. Yes.
Yeah, can you share the screen?
Yeah, sir. Okay. Screen share. Screen share. Yes, sir.
Yeah. Yeah, fine. So to start with my topic, as I showed in my slide, the title slide, COVID-19 with that RNA virus and diabetes. So that is the hyperglycemia increase with the blood glucose level. So let me make my slides to share in a very crisp manner what exactly I am going to discuss. So first let me discuss about the background of the coronavirus, how it has been, the history, how it has been happened. And next coming to the origin and transmission of SARS-CoV-2, how it is being named and how it has been transmitted. And what is the major pathogenesis of SARS-CoV-2? And epidemiology status, which I have been collected just 1 hour back from the website, and some of the signs, symptoms, risk factors, and complications. So this slide where it is going on operating every day with various risk factors, and what are the basic diagnostic tests available in India and globally for testing the COVID-19, and how we are going to manage this COVID-19 with the drugs which are available. And then coming to one of the comorbidity, what is diabetes mellitus, and how we are going to manage the diabetes mellitus with COVID-19, and what are the key perspectives to be considered for the management of diabetes mellitus with COVID-19. So to start with background of coronavirus 2, so how this disease is being named and from where it is being occurred. So you all will be able to see a beautiful image. So this is the place of China, Hubei, Wuhan. So if you see this, in December 2019, in few patients, 3 to 5 patients who are suffering from pneumonia, they've identified a newly beta coronavirus in that particular place. The previously one coronavirus which is named SARS-CoV-1. So that's why it is named as a new identity coronavirus. And if you see initially the proposed name by WHO in 12th January 2020, they have named it as novel coronavirus 2019 nCoV. However, in 11th February 2020, WHO proposed with the name coronavirus 2019 as COVID-19 by WHO, and also the CSG International Committee, that is Corona Study Group Committee of Global, they named it as SARS-CoV-2. What we are following with both the names, that is severe acute respiratory syndrome coronavirus. And if you see in the March, then they identified that patient 0 of age 55, and they were searching for this patient 0. So in 17th November 2020, the China's first confirmed case, that is a person you call the first carrier of this disease. So that's why it's named as still patient 0. So this is the background of how this has been emerged. It has been named as COVID-19 or SARS-CoV-2. And this COVID-19 is still an infectious disease caused by SARS-CoV-2, and it is still ongoing pandemic. You can see more than up to date today's morning data, more than 200 countries are still suffering from this disease, infectious disease, and still it is going on. So what is this SARS-CoV-2? As I mentioned, it is a beta coronavirus, which is enveloped with non-segmented positive sense RNA virus, which belongs to the subgenus of Sarbecovirus and subfamily of Orthocoronavirinae. And if you see this, there are some 4 genera, which is including alpha, beta, gamma, and delta. Previously, if you say, some 6 coronaviruses have been identified as human susceptible virus, which is named as alpha CoVS HCoV, and it is named like this up to HCoV OC43. So if you see this previous 6 coronavirus, they have low pathogenicity causing mild respiratory symptoms. If you see among these alpha, beta, gamma, and delta, this beta coronavirus is mainly affecting the mammals and humans. And if you see this beta and delta, they are affecting the pigs and mainly the birds. And the other two coronavirus, that is called beta coronavirus, that is, we always remember the SARS coronavirus and MERS coronavirus. So these two viruses, if you see, comparing to the previous, they are severe and potential fatal respiratory tract infections, which they call severe respiratory tract infections. And just if you're going to the structure of this coronavirus, so it is being named as corona due to the spike site protein, which is crown. And there are some four proteins to be remembered. One is the nucleoside protein, where it bonds to the single strand RNA genome to make the nucleoside. And the other one is the spike protein. So this is very important protein where we are going to discuss in the management, where it is critical for binding of host cell receptors to facilitate the entry of host. So through this only the virus enters inside. And next is the envelope protein, where it interacts with the membrane protein to form the viral envelope. And finally, the membrane protein, which is the central organizer of the COV assembly, which determines the shape. And so this is a small structure to be remembered. However, we'll be discussing the next slide about the genome of this coronavirus 2. As I mentioned, we see the transmission, the phase 1 and phase 2. It is highly pathogenic COV, as I said. The primary host reservoir may be suspecting as bat, either for COVID-1 or COVID-2 or MERS-CoV. But it is suspected for this, but for 2019, it is still a question mark. And you can see the intermediate host of the animal. It is a cat, and here it is a camel, and here it is SARS-CoV-2 is a pangolin, and from human to human. And this is about the low pathogenic severity. So for all the cases, you can see it may be a bat or it may be an animal. And the second phase is from human to the human. So what is this difference between this highly pathogenic human coronavirus, that which is causing the illness in pneumonia? So to highlight some of the few points, the year of isolation, you can see 2003, 2012 MERS-CoV, and 2019. And the receptor in which they are going to bind and showing the expression. So 2003 and 2019, it is angiotensin converting enzyme, ACE2. But for MERS, it is DPP4. And the incubation period is mostly 2 weeks, 2 to 14 days, a mean of 4 to 5 days. But in the case of SARS-CoV-2, it may go up to 20 days. The mode of transmission, if you see with the CO2, the respiratory droplets, airborne, contaminated fomites, it's the objects, and human to human community spread, so oral, fecal, and still it is going on. And the mortality rate in the MERS, it is more, it is about the expected only which is occurring in a particular area of Middle East, Southeast Korea, 34%, and SARS-CoV-2 still it is going on increasing. And the disease symptoms, moreover, the three most important key symptoms is fever, dry cough, and shortness of breath, and it includes various other symptoms also, where we are discussing separately. And SARS-CoV-1, which occurs in China, and SARS-2, as I said, Middle East, such as South Korea, and this 2019 COVID from China spreading throughout more than 200 countries. The reservoir, as I said, the primary host is expected to be the bat, and intermediate host, here it is civet, and here it's camels, and here it is Malayan pangolin. That is for the SARS-CoV-2. And how it is been compared with SARS-CoV-1, because the genomic sequence of this SARS-CoV-2 is 96.2% identical to the bad CO, that is the genome is RATG13, in which this shares nearly 80% identity with the SARS-CoV. So that's why they said it may be from bat. So that is clearly it has been shown for all the things the origin is bat. And based on this virus genome sequencing results and evolution analysis, That's why, as I told you in the first slide, that has been suspected as the host of virus origin, and it may be transmitted. But still, if you see during this December month or during this January, so this is the market shown in Wuhan, where there is no evidence of sale of this bat, but still we expect it may be through the bat, and because the SARS-CoV, where it is identical with 79.5 percentage. And now with some of the hypotheses, it is clear that SARS-CoV could use this AC2 enzyme, angiotensin converting enzyme, that is the same receptor where I told you as that of the humans to infect the humans. So the importance of this AC2 enzyme is more important because we know that in the case of the diabetes, with that of the hypertension, they go with AC or the ARB inhibitors, the drug of choice of drugs for hypertension in the case of the diabetes. So coming to a rough idea about the genomic organization of SARS-CoV-2. So if you take this genome encodes two large genes. One is that ORF1b, which is in blue, and ORF1a, that is showing in the yellow color. These are the two large genes where it is encoded with the non-structural proteins from NSP1 to NSP16. And if you see once again, these NSPs, non-structural proteins, they are processed to form the RTC, that is the replication transcription process that is involved in the genome's transcription and replication. For example, if you're taking NSP3, so this is encoded for papain-like protease, and NSP5 is encoded for 3CL, that is 316-like protease, respectively. So both these proteins, they function in polypeptide cleaving and block the host innate immune response. So one of the target of the management of COVID is by blocking this NSP3 and NSP5, where it is preventing from the host innate immune response. The same like that, you can see NSP12, they encode for the RNA-dependent RNA polymerase, and NSP3, they encode for the helicase. So therefore, the structural genome encode the structural proteins, as I mentioned, S protein, E protein, M protein, N protein, they are the structural proteins. So other than that, there are some accessory proteins also, with shades of gray in color, and they are unique for SARS-CoV-2 in terms of number, genomic organization, sequence, and function. So this is a simple genomic structure where it shows about what are the types of proteins which are involved. And if we see mainly the spike protein is involved, where it goes and binds to the ACE enzyme receptor. So that is the same explanation is being given here. And next, coming to the life cycle of SARS-CoV-2 in the host cell. So this is an important slide if you see, where most of the drugs come and target for this condition. So we will be able to say this is the coronavirus SARS-CoV-2, and this is the cytoplasm of a cell, of a host cell, and here you can see the cell membrane. Here if you see a cell membrane, you can see the receptor of this ACE2. So here the process is by two ways. One, it enters through endocytosis, and then it goes out of the virion node through exocytosis. So endocytosis through entry of the virus, and exocytosis is the exit of the virus. So let's see what are the process takes place. So it is a simple process of protein synthesis. So as I told you in the image, there are four types of proteins. Mainly the spike protein will come and bind to this receptor. So this SARS-CoV-2 enters the target cell through the endosomal pathway. Endosomal pathway by cell engulfing. So first is S protein. As I mentioned, they go and bind to the ACE receptor, and it forms a complex. So this ACE receptor and this virus, they forms a complex. So once it forms complex, what happens? It gets translocated to the endosomes, where S virus is being cleaved by the endosomal acid. So there is an acid protease called cathepsin L. So this activates the fusion activity. So this cathepsin will activate this fusion activity. And then what happens? This viral genome is being released. That is 5 and 3, the subunits of the viral genome is being released into the viral replicase polypeptide proteins, that is PP1A and PP1AB, which are then cleaved into smaller products. You can see that by the process of proteolysis into smaller products. And then what happens? The subgenomic strand, negative strand templates are synthesized. Subgenomic negative strand are synthesized by replicase, and from discontinuous transcription plus standard genome, and here it serves as a template for a mRNA synthesis. So this process forms a mRNA template. Here it is negative. You are able to see this. So this full strength negative strand template is made a template for genomic RNA. Then what happens after this transcription? The viral nucleosides are assembled from the genomic RNA and N protein in the cytoplasm, following the assembling and budding into the lumen of this ERGAC. So here the ERGAC is the endoplasmic reticulum Golgi intermediate compartment. So that means this mRNA, that the virus, it utilizes the DNA of the host cell for making the strand. And therefore what happens once after forming the strand, it gets again replication, and then it is been packed, and then when it exceeds the virus load by the process of exocytosis, it gets released. Now, if we see the targets of the drug, that is from binding to the receptor until the process of the viral load, the drugs will be acting in all this process, either in the process of the prevention of fusion, for example, your chloroquine may be acting, or by the process of inhibiting this replication, or by the process of inhibiting transcription. In all these ways, these drugs may be acting. And next, coming to the epidemiology of this coronavirus. So up to date, if you take, where I have collected from morning, some 9:30, if you see worldwide, 13.2 millions confirmed cases, required 7.3 millions, and death, that is 575 lakhs. And if you see the worldwide, there is going on increasing case. And if you see our India is in the third case, so it's nearly moving to 9 millions. And you can see the death is around some 24,000. So just 1 hour back it is collected. And if we see the total epidemiology status, so month by month, you can see a gradual increasing in the case. So that's the thing, if we are saying, comparing to the previous months, the new cases from it is going on increasing day by day. So still we don't know how it will be reduced. Still further plenty of researchers and plenty of lockdown process undergoing on. And if you see in India, as I mentioned, it is nearly 9 millions confirmed, 5 millions recovered, and 24,000 death. And if you see, the first stands the Maharashtra, and second stands the Tamilnadu. Still every day new cases are being seen, and the total, it is same as a worldwide case. The total cases has been going on increasing, and the new cases also is be going on increasing. You will be able to see there is a gradual increase in the case, but there you will not able to see the decrease at all. So that is about the epidemiology of the case, where it has been updated every 1 hour from the websites. So coming to the common symptoms of this coronavirus, initially they have started with some 3 to 5 symptoms. Now if we see day by day, there are plenty of symptoms are also included. So initially they started with cough, sore throat, a fever, and then muscle pain, chills, shortness of breath. And if you see, the fever was observed in mostly 83 to 99 percentage. So that's why initially they will be checking for all the persons who are traveling from abroad or within the country with various travels. They will be checking with the fever has been considered. So then loss of appetite, fatigue, a loss of smell. Also, if you're not able to feel that smell, and then they may consider you are in a symptom of COVID. And cough and muscle aches, pain. And in severe cases, you may see difficulty in walking, confusion. So nowadays, due to the stress, automatically people get confused. And it turns to bluish space of lips, coughing upload, chest pain, and decreased white blood cells. So that is an important thing in case of COVID-19 as well as in the diabetes also. The people will lose their immunity and possible of kidney failure and a high fever. And this is the statistics which has been taken from one country. So it varies from country to country, but you can see now the diarrhea is also been included in the symptoms where starting from fever. So fever uploads around some 87 to 9%. So highlighting is the three common key symptoms: fever, cough, and shortness of breath. And coming to the complication, as we said, first it goes and affects your lungs. So that's the case which has been identified by China. That is the pneumonia. By normally taking a X-ray or a chest X-ray, it can be easily identified. And ERDS, that is acute respiratory distress, it may lead to multi-organ failure, septic shock, and death. And then cardiovascular complications starting from your stroke, from your hypertension, heart failure. So like that, damaging the blood vessels, it goes like that. And among the blood group, in a study they found that the type A blood group, normally they have shown 48% higher with the type A blood group, but the exact reason for that is uncertain. It was a clinical study which has been performed. And among in 20 to 30%, they have seen there are elevated liver enzymes reflecting the injury, and some of the neurological manifestations affecting your nervous system, including seizure, stroke, encephalitis, and Guillain-Barré syndrome, which includes a lot of motor functions. And the most complicated development in the children is the pediatric multisystem inflammatory syndrome, which is moreover related with the Kawasaki syndrome, which is found to be fatal. And then if you see these complications, as I mentioned, how these symptoms arises. So they said initially it starts from your mouth, your throat, and then it enters your lungs, and then it enters the blood. So initially, nowadays you may be seeing the persons with asymptomatic also, while they check, they may find positive also until the 15 days incubation period. So initially, if you take day 1 to 3 is called onset of symptoms, where you see 80% of these patients get mild symptoms, where it starts from your upper respiratory symptoms, from your throat. So normally they say it lives 1 to 3 days in your throat. If you're going to gargle with salt water, so then automatically or hot water, then it may get relieved. And day 4 to 9, you can see once after 3 days, it enters through your lungs, where 14% of those infected experience have severe symptoms. And next, if you see after day 9, then you will be able to see in the blood. There you can see the 5% of these infected, they need the ICU care. So therefore we can say the first 3 weeks of the crucial period. So that's why the government and the districts, everywhere they have taken precaution in bringing the lockdown for at least the first 2 weeks or first 3 weeks, because crucial period where it may not be pandemic or it may not be transmitted. Normally, if you see the death, it is occurring between the 15 and 22nd day on the onset of symptoms, and the discharge where they have been from the hospital also is from 18 to 25 days. So this is the way where the incubation period and how the symptoms happens, the death, and it can be discharged. And if you see who is the risk, already we know that the elderly patients above 60 years and the person who are having with the comorbidities such as hypertension, heart problems, and diabetes, and you can see the young children, and then you can see the pregnant women. So all these are risks during this COVID-19. So by CDC, the Control for the Disease Center, they have given what is the risk in 4 stages. So no risk, that is you can walk with the people who is tested positive and was not experiencing symptoms. Low risk, you can be in the same room with that person with a difference of 6 feet. So that is the thing they are saying us to maintain with the 6 feet with the face mask. Medium risk is that the close contact it should not be more than 10 minutes longer with 6 feet where he is having some symptoms. And the high risk is close hold that forbids contact with the person who is tested positive. So this is considered to be important according to CDC. That is the objects, the household objects in where a person suffering from COVID-19. So we should take precautions. So that's why we are bringing a lot of preventive measures by using sanitizers. By using sanitizers or any disinfectants which is made up of isopropyl alcohol. How are you going to diagnose this COVID-19? So there are specifically two methods. One is the diagnostic method, the other one is the antibody testing. So imagine if it is an acute infection. So you can go with the molecular test, which is with the RT-PCR. So the most widely accepted method for detecting the SARS-CoV-2. It is a positive means it is a confirmed case. And if it is a negative, imagine, repeat the test if clinical findings match with COVID-19. By saying negative, PCR does not alone rule out infection. So still there is a possibility of reoccurrence. So this is in the acute infection. During infection, so during the period of this 3 weeks, we have to assess the severity of the infection. One is called the biochemical monitoring with several markers. So that is the CRP, reactive proteins. When there is increase, so more severe case predicting mortality, and when there is decrease or normal, patient is starting to recover from mild disease. So this is the way how the persons are recovering. And post-infection and epidemiological surveillance. So it is based on the immune response activation. As I told you, it is the antibody testing IgG or IgM. So it is a positive means, that means he is having a past COVID-19 infection. And if the patient with the respiratory symptoms confirmed with molecular test to exclude coronary infection at infectious stage. The negative means it does not rule out the possible past infection. It can mean the test is done too early and no antibodies are produced yet. A repeat test later. So nowadays we are going with the plasma COVID test. That is, we are taking the plasma from the infected person and giving to the normal person who has been affected with the COVID-19. So therefore now, as per the FDA, which is been submitted last 2 weeks, there are two types of diagnostic testing. One is called the diagnostic test. That is, one is a molecular, that is the RT-PCR test, what I said. The other is the antigen test, where they specifically detect the specific antigen. And the second one is the antibody test. So they're saying to see whether any antibodies have been developed due to the immune response due to the infection. So these are some of the characteristics given by the 3 tests: molecular test, antigen test, antibody. So normally this test, as I said, it is a molecular. Test where we follow. In both these 2 tests of diagnostic test, we are using the nasal or throat swab. In molecular test, it may take up to 1 week, but this antigen test is 1 hour. tested, but if this is showing positive, it is usually accurate, but negative results may need to be confirmed with this molecular test. So it is further to be confirmed. So both the case diagnosed active coronavirus infection, it shows. And what it can do, show you are ever had a COVID-19 were infected with coronavirus in the past, and definitely it may rule out from the active coronavirus infection. So antigen tests are more likely to miss an active coronavirus infection compared to molecular test. So initially they may go with the antigen test and further confirm with the molecular test. So this antibody test where they take the blood or the serum, you call it as a serological test. Here we go with the finger stick or blood withdraw. So it may take some 1 to 3 days. That is the way we can collect the blood from a different location, and it can be stored and it can be checked. Sometimes the second antibody test is also need to confirm it once again, and it shows you have been infected by coronavirus in the past. By diagnosing this active coronavirus infection at the time of test, or show that you do have COVID-19. So normally these are the 3 basic tests followed as per the FDA. To start initially with the antigen and then to confirm with the molecular. Further during this post-infection period to see whether they developed of antibodies, they go with this. So plenty of these rapid diagnostic test kits from different countries within India also are available for checking with different prices. So this is the new technology where we can go for rapid point of care diagnostic test where the mucus sample is collected and it can be put in the office, or it can be directly collected from the home, or sometimes by spitting, that is directly from the saliva also it can be collected and it can be checked. So that is about the introduction about what is coronavirus, what is the genome of coronavirus, what is the life cycle of coronavirus, what are the symptoms, what are the risk factors, what are the complications, and how it is being transmitted. So now, as I told you, up to current now, there are plenty of drugs which have been repurposed for COVID-19. All these drugs are under human clinical trials, phase 2 and phase 3. And there is an update that it may be approved in an individual country, but they have to pass all this clinical trial. One vaccine has been passed as clinical trial by Russia, what I'm going to explain in the updates in the last slide. So the most commonly used drug for the management of COVID-19 is antiviral drug. That is remdesivir and favipiravir. These are the 2 drugs available. Other than that, your protease inhibitors such as lopinavir, ritonavir, and TMMSSR2 inhibitors such as camostat, mesylate. So all these are antiviral drugs. And anti-malarial drugs are also being used initially. So what not I'm going to say the management of COVID-19, these drugs were used initially for the symptomatic relief in the management of COVID-19. But at today present, we see some of the drugs have been withdrawn due to its unwanted adverse effects. And glucocorticoids, mainly the corticosteroids, dexamethasone, it is used as a life-saving drug. And biologics, that is, you can say monoclonal antibodies, tocilizumab, sarilumab, they didn't find any mortality case. And now one more bolituzumab. This one drug has been approved by DCG by India to be used. And for symptomatic, they give ibuprofen, indomethacin, and they go and interfere with this ACE2 expression. And ROS antagonists are considered to be important because they have a major role in the expression of this ACE, and therefore the care should be taken for a hypertensive patient or for a diabetes patient while using these ACE inhibitors or these ARB inhibitors. So coming to some of the characteristics of this drug and to know what is the mechanism of therapy, that is at which stage it goes and blocks the process, the replication transcription process, and what is the status of COVID of this drug. So now we see the most common drug remdesivir and favipiravir. They are nucleoside analog which belongs to, And as I showed you, the second step, the replication process, they directly go and interfere with the replication process. So where I would like to show you, so this is the replication process where remdesivir go and block it. That is the RTC complex where it forms. So here they go and block with the polymerase enzyme. That is, this favipiravir also go and bind with this viral RTP, which is essential for that process and reduces its reproduction. So both these drugs are in the phase 2 clinical trial and they may enter the phase 3 trial. And this lopinavir and ritonavir, they're HIV protease inhibitors, and they can act by inhibiting this protease enzyme, that is the protease cleavage, with interfering with the virus replication. So protease, you can see here, this is the process where they can go and inhibit. So, but however, due to its adverse effects, WHO has withdrawn it and it has been not recommended. Another drug which is quite interesting, chemostat mesylate. So this is a transmembrane protease serine 2 inhibitor interfering with the viral entry. It is also in the investigational second 2 process. So if you see here, as I mentioned to you in the cell membrane, we are having the ACE2 receptor as well as this transmembrane protease serine receptor. So this chemostat mesylate may go on inhibit this process. That is, the binding process has been inhibited. So like that ivermectin, so they are also being used in vitro by inhibiting the replication process under investigation. And some of the other drugs such as mefloquine, selamectin, they are having the antiviral and anti-inflammatory activity. They are having a cytopathic effect of SARS-CoV-2. They reduce the cytopathic effect and decrease the viral load. So then it remains inside the cell and there is a possible of lysosomal activity also. Still they are in the investigational process. And as I mentioned, so this is the line of attack in the different process where it was made simple, as first one is the fusion and endocytosis, second one translation, proteolysis, translation and replication, packaging, and viral release. The first stage where it is going to bind to this receptor, the monoclonal antibodies, the Zumab, where I told you, and the covalent plasma, they may go and bind to this. So that is shown clearly. So normally this virus, normally what happens, these antibodies will go and bind to this virus and it will try to block this activity of entering into it. So that is the role of this monoclonal antibody and that of the covalent plasma. So that is the first stage. And another drug, as I told you, TMPR, SSR, which is going to inhibit. And in the process of this, after this endocytosis, you can see this chloroquine or hydroxychloroquine, they are involved in this fusion process, endosomal fusion process, by increasing this endosomal pH. And as I told you, which inhibits the proteolysis lopinavir, ritonavir, it is withdrawn. And this antiviral drug, mainly they are intervening this replication transcription complex, that is RNA dependent and RNA polymerase. They prevent it from replication. So these are the line of drugs which are acting and which is currently they're repurposing, where I highlighted and shown the first 2 drugs which is making a block entry in the step 1. And once again it is been shown clearly this remdesivir is a prodrug and it is converted into active metabolite GS441524, and where it prevents the further replication of this process, where it will make them not easily to form the single stranded RNA from the host. So it is a potentially repurposed drug among the drugs available. The same image is being shown for you to understand with that of the hydroxychloroquine fusion with vesicles, polymerase inhibitor, protease inhibitor, and fusion inhibitor. So making it simple to understand. So these are the drugs which are available today for repurposing for COVID-19 as per the data obtained from CDCE, WHO, and DCGI. So coming to the comorbidity of this COVID-19, as I told, as the source CV2 enters the cell membrane through ACE2 or TMPRS2. So there are some other receptors are also been involved. So you can see the comorbidity conditions, mainly the hypertension, diabetes mellitus, neurological disorders, kidney disease, thrombosis. So like that still going on. So today they have shown that even with the patients with AIDS, with that of COVID, there is a possibility of more mortality rate. So among all these things, just I have been highlighted. The first is the cardiovascular disease of 13.2%, and hypertension. So moreover, all these are comorbidities of diabetes and CVS, so which include obese, the lung disease also. So now coming to diabetes, I think everybody know what you mean by diabetes. So that is, it is a metabolic disorder where you can see the increase in the blood glucose level. The condition you call it as hyperglycemia. So just I've shown you the healthy diabetes, how a glucose gone binds to the receptor, and in type 1 the pancreas failure to produce insulin, and in a type 2 you can see that the cells fail to respond to insulin properly. So these are the two major types of diabetes mellitus, and there are other diabetes which is gestational diabetes occurs during pregnancy. And you know some of the signs and symptoms, that is you can see polyphagia, weight loss, underweight, tired. So we know that polyuria, polydipsia, polyphagia, the three P's to be remembered. And if it is increased with hyperglycemia, you can go with the blood vision. And the complications of the high blood glucose level, we know that diabetic, that is mainly the diabetes retinopathy, diabetic neuropathy, diabetic nephropathy, and diabetic encephalopathy. So these are the four most complications to be known. And this diabetes also, if you see throughout the global, there is increased rise in the diabetes mellitus, mainly the type 2. Now if you see, you may be able to see the double or triple during the age of, that is after 15 years or 20 years. So therefore, this diabetes mellitus is considered to be one of the important comorbid conditions in the case with the COVID-19. And these are the various drugs which are available for diabetes mellitus current use. So I'm not going to explain in detail. So just to know briefly, we know that insulin is one of the important drug which is injection form. It is being given due to their major effects on lipid metabolism, growth, or protein metabolism. It acts through the GLUT4 receptor, and mainly it is given in the type 1 and also in the type 2. And you are coming to sulfonylureas, say glimepiride and glipizide. So they directly act on the beta cells and stimulate the insulin secretion, directly acting on the pancreas. And bigonides, we are having the metformin. So they act by decreasing the glucose production and increases the glucose uptake. And the other two drugs comes into which category of GLP-1A receptor agonist and DPP-4 inhibitor. So if you see the GLP-1 receptor antagonists, they have a direct action on the brain and appetite center by suppressing the appetite, and directly on the stomach where it's slowing the gastric emptying rate, and directly acting on the pancreas cells by increasing the insulin secretion or by decreasing the glucagon secretion. That is about the GLP-1A. And nowadays we are using the gliptins, that is the DPP-4 inhibitors. So they act by inhibiting this DPP-4 enzyme, where this DPP-4 enzyme is involved in increasing this GLP-1, RA, and other incretins. So therefore, by inhibiting this, it may be having a direct action. And we know about the thiazolidines, rosiglitazone and pioglitazone, that their role in glucose uptake as well as decreasing the glucose production in the liver. And sodium glucose, this transport inhibitors also in the blood glucose, they directly act on the kidney and increases the glucose excretion in the urine by preventing the reabsorption. So therefore, these are the currently available drugs which are being used for diabetes mellitus. And here you can see in the condition of hyperglycemia, that are some of the putative mechanism. We say some of the suggested mechanism. There is a possibility of increased accessibility in COVID and with the diabetes mellitus. I've already told you, whenever you are going for this testing, CPR testing, you may find a decrease in the WBC count. So that may be one of the important thing, a parameter for the immunity. So that is the thing where the persons lack immunity are easily susceptible to this disease. So you can see that there is an entry of CROs in your respiratory tract. Two things. One is infection in the respiratory epithelium. There it causes the necrosis of respiratory epithelium. So this is the way how it leads to pneumonia and ADR system inflammation and multi-organ dysfunction and directly to the cytokine storm. In other case, it may go for the acute renal injury. And the same SARS-2, they have that acted impaired macrophage activity. And the most important thing is they increase the ACE2 expression. So that is the one of the things we should be precautious while taking this ACE or ARB inhibitors. So therefore, all these cases, they lead to the cytokine storm, either by impaired macrophage activity or impaired neutrophil count or impaired these immunity cells, CD4, T4 cells, and impaired antigen presentation. So whole you can see there is a dysregulated immune response where it will be easily susceptible for a patient with diabetes mellitus with a higher blood glucose level, hyperglycemia in the case with COVID-19. So that is the simple highlighting point is a well-controlled blood glucose level. The survival is 98.9% in the case of COVID-19. And when it is a poor control, so there is a possibility of the death rate. There is a possibility of the death rate. And the same thing I have shown here also. Uncontrolled glycemia affects the immune response. How it affects I have shown. Organism will become more susceptible. And simultaneously, the important thing is here, when treatment with ACE inhibitors or ARBs, this upregulates this ACE2. So this ACE2 enzyme upregulates, there is a possibility of protective effects such as the anti-inflammatory effects are also available. However, this may potentiate the SARS-CoV-2 cell entry. So the question is whether the potentiation effect or the protective effect of the entry of SARS-CoV-2. And once again, it leads to pancreatic beta cell damage and uncontrolled. The process takes place once again. And the possible drugs is being given for diabetes patients along with the oral antibiotic drugs is they've given chloroquine or TMP or SS2 inhibitor, but still they have some of the adverse effects. So now what are the possible drugs given in diabetes mellitus with COVID-19 and what should be monitored and then what is in practice? So insulin is the choice for type 1 diabetes. I think there is no other choice. One of the important adverse effects of this insulin is hypoglycemia. So therefore, this hyperglycemia requires to be monitored. There is a possibility of high risk and it is no other choice, the drug of choice in critical ill patients. Metformin, biguanides, there is a risk of lactate acidosis in hypoxia and acute illness. So therefore, stop if severely ill with hemodynamic instability or hypoxia. Coming to sulfonylureas, so we know that mainly there is a risk of hyperglycemia if oral intake is poor with the concomitant use of hydroxychloroquine and chloroquine. So care should be taken and we should stop if unable to maintain the regular food intake or at risk of hyperglycemia. And with the pioglitazones, you can see the risk of fluid retention and edema that may be contraindicated in hemodynamic instability. So if it is severe case, it may lead to hepatic or cardiac dysfunction. So it should be monitored. And you can see the other comorbidity drugs. We are using the SGL2 risk of dehydration and ketoacidosis. So this ketoacidosis should be monitored and it should be stopped. The GLP ARPS, as they act a direct effect with the uptake center, the GAT side effects should be taken into consideration. And if it happens, we have to stop it. And DPP-4 inhibitors, they may be prescribed and may be continued with the non-critical ill patients because there is a lower risk of hypoglycemia and possibly a wide range used for renal function. And as I told you, these are some of the other related comorbidities along with the diabetes, with hypertension, the drug of choice with AC1 or AC, that is ARB. So here there is a possible uncertain risk of increased susceptibility for infection, where I showed in the previous slide. And sometimes we may give aspirin as an antiplatelet agent. Risk of cardiovascular disease and GIT also should be taken. And statins, normally we are given with diabetes with hyperlipidemia conditions. So the possible risk of myositis and transaminitis to be considered. But the risk-benefit ratio for the individual patient to be considered. So based on all these drugs which are available for diabetes mellitus and for the management of COVID-19, the WHO suggests some of these drugs previously. Chloroquine and hydroxychloroquine may be given, but the caution with hyperglycemia, as I mentioned, with insulin and insulin secretagogues. And lopinavir, ritonavir may be given, but we have to see the hyperglycemia and also the interaction with statin because the risk of hepatic and muscle toxicity. Glucocorticoids, life-saving drug, we know that that is also for COVID-19, but this drug is having one of the adverse effects of hyperglycemia. Therefore, the blood glucose level should be monitored. Remdesivir, favipiravir. So these are the potential repurposing drugs which are under the clinical phase 3. So the hepatotoxicity is adverse effect. So the risk-benefit ratio to be considered. So these are some of the drugs which are being managed for the treatment of, you can say, COVID-19, not treatment, we can say management of COVID-19 along with diabetes. And what are the key perspectives to be considered in COVID-19 with a patient with diabetes? There are 4 important key perspectives. One is the first one is the hygiene and social distancing, where it is widely recommended. And second one is the glycemic control, regular medications, monitoring all the levels, healthy lifestyles with exercise and vegetables, stress management, and the comorbidity control and routine vaccination. So that is been highlighted with the proper hygiene, with the social distance, regularly monitoring the blood glucose level, keeping your health diet with vegetables, fresh leaves, and monitoring the diabetic ketoacidosis condition, and at least doing the regular exercise where it may be reduce the risk, and you may also have some meditation, good sleep, and avoid the smoking, alcohol. And we have to check for the comorbidity conditions, diabetes or comorbid conditions, and we have to go for the routine vaccination. So these are the key perspectives to be considered and to be managed with COVID-19 with the patients with the diabetes. And if you see yesterday, Dr. B. Suresh, President of Pharmacy Council of India and Pro-Chancellor of JSIR, in one of his slides where he's giving the webinar about the pharmacy profession in Kashmir University, he has shown there are so many drugs in COVID-19 with the dancing. Many drugs comes with many countries, with many companies, and such as Remdesivir with their approval status in the phase 2 trials. And WHO also, as I said, they discontinued this hydrochloroquine and lopinavir, ritonavir arms for COVID-19 and approval of ivermectin in the phase 2 trial. And you know that this remdesivir is also approved by Japan for treatment with the patients, but outside Japan it is understood the IND drug. And you can see the dexamethasone, as I told, corticosteroids, the first drug shown to save lives. So like that, there are plenty of drugs which are available coming every day with their approval status. And if you are seeing the vaccine tracker, there are more than, if we can say, what I read is more than 122 vaccines are available throughout the globe, where which has come out from the preclinical testing. It is shown here. They all are with either a phase 2 or phase 3 clinical trials. In India, you can see Zydus Cadila and Covidax with Bharat Biotech. These two companies are coming out. And therefore, yesterday's news, you can see Russia's Shivan University completes the human trials for COVID-19, but completing with one country, it cannot make out for the management of COVID-19. India is also playing an important country where you are having the economy and the human resource to be carried out in a different types of people. And I think yesterday's news, Biocon got approval from DCGI and a hike of 10%. They use this monoclonal antibody, that is itolizumab, for the COVID treatment, which updated the 15 hours ago. So therefore, giving a brief introduction about COVID-19 management of the drugs and how to manage in the case of the diabetes. But I still say, the research and innovations on vaccine drugs are under progress, and still further information to be collected day by day. And I would like to say, stay home, stay alive, because nowadays the lockdown started happening everywhere. And that is the way only we can help to stop virus. Stay home, keep a safe distance, wash hands often, cover your cough. If you're sick, please call the helpline which is being provided. So previously we saw some of the health professionals are called the warriors. Nowadays, each and every person in the community, society, all are considered as warriors. So I would like to thank all and one and all the COVID-19 warriors. So thank you. And if you're having any questions, if I'm able to answer, and let me answer.
Sir, thank you. Thank you so much, sir.
Okay.
Right. So actually, your session is highly informative, sir. You had proved that being a pharmacologist, you had clearly explained about what is mean by the coronavirus and what is the source behind the transmission and what are all the drugs which are all acting on what kind of receptors, as well as nicely you had joined the diabetes mellitus along with that, and you highly impressed us. Definitely, it's informative, sir. Thank you so much.
Thank you. Thank you.
Yeah, sir. So now it's the time for questionnaire session.
Yeah.
The suggestions and the questions from our participants are entered into our question answer box, sir.
Yeah.
Now we can invite Mrs. Gladys Kalpana, Professor, Department of Pharmacology, Nandha College of Pharmacy, to join with us for this discussion. Please, ma'am.
Yeah.
Hi, sir. Good afternoon, sir. How are
good
you?
afternoon.
Is it audible, ma'am?
Yeah.
Yes, ma'am. Yes.
Yeah, I'll throw one by one questions from our participants. And the first question is from one of our participants is, can COVID-19 trigger the onset of diabetes? That is, new diabetic patients are emerging.
Yeah. So I think this is a question to be asked for a diabetes specialist or a physician. Okay. So now comparing, as I mentioned in my case, so diabetes is one of a metabolic disorder where you will be able to see there is an uncontrolled glucose level. If the person is not able to maintain this glucose level for diet or exercise or stress, then definitely it is going to worsen the condition along with this COVID-19. And we cannot predict that the mortality is less in India, because if you see, in India, the government has taken some initiative steps by bringing the lockdown for the past 3 months, and it has reduced the mortality rate. Where in the case of US, I think you know about the Trump. He has given a misdecision by using directly the disinfectant as an injection. I think it is already commented everywhere. So that's why their rate is high. But comparingly, in future weeks or months, we have to wait and see who is going to be more, how we are going to control it.
I think you have answered the another question from our participants also.
Yeah.
The next question from our participants is they is asking why diabetic patients are more prone to be affected by COVID-19 infection.
Yeah, good. I have shown in one of my slide. It is due to the dysregulated or decreased immunity. You know, the macrophages, the T helper cells. So due to this hyperglycemic condition, what happens? Their immunity response will be decreased. So when the immunity response is decreased, automatically what happens? It makes easy for the virus to replicate and do the process. Okay. So that is one of the reasons. So when you, if I want to put a simple power, when your immune power is less, you are easily susceptible for this coronavirus.
Yeah, and the next question from one of our participants is, does the COVID-19 viral protease cleaves the viral polyprotein fusions in order to make them function?
Yeah, that's what I said. In the case of proteases, what happens? In the third step, this COVID-2, it will utilizes the enzymes and it will try to make a single strand, that is by forming the polypeptide, and it is based upon the host function of the cell. So now simple thing if I want to say, this single strand RNA, that is the coronavirus, utilizes the genome of the host cell to make it active, and by increasing the virus load it comes out. So therefore definitely it utilizes the host cell to make the mRNA functional, not the host functional. Normally what happens, the host cells get infected.
Okay, thank you, sir. And the next question is, doctor, which ACE inhibitor drug is used for the treatment of COVID-19? And another question from the same participants is, why ibuprofen is denied in the usage towards COVID-19? And they are asking about your suggestion, sir.
Okay. So, as I told you, as a pharmacist, as per my knowledge, I may give my suggestion. Normally, no drugs are used for treating COVID-19. You keep in your mind. This ACE inhibitor, angiotensin converting enzyme inhibitor, normally they're used in a diabetes patient or in an antihypertensive patients. So normally, while you're using this drug, what happens? It will go and block this ACE enzyme. So this will what happen? It will upregulate ACE. That means it will increases, that is expression of ACE. Therefore, what happens? It becomes easy for the virus to entry inside. So my thing is that whenever you are using a AC inhibitor or a AAR inhibitor, the proper monitoring a care should be given. So definitely using AC inhibitor is used not for treating COVID. It is been used for hypertensive or in the case of hypertension with the diabetes. In that cases, what happens? It upregulates the ACE. Therefore, the coronavirus easily it attacks inside the host cell and still it makes the condition worsen. Makes the condition worsen. And ibuprofen was given as a what I can say you as a symptomatic relief in the case of the pain, and this also upregulates the ACE2 enzyme expression. That's why this ibuprofen non-steroidal antimalarial drugs, as per WHO, it has been not recommended.
Okay, sir. And the next question from one of our participants is there any change in treatment modalities for COVID patients having diabetes?
That's what I have given two slides clearly. It is based upon case by case. We have to see a type 1 patient is taking insulin. We should know what type of insulin is going to take. So when he's taking insulin, the hypoglycemia considered is to be monitored. Then if you're going for another different types of drugs, I have showed what are the parameters to be monitored, and if it exists, you should stop it and you should go for another alternative drug, because there is no only one category of drug. There are 4 to 5 category of a drug. So it is based upon the individual case what a diabetic patient is taking, and he may shift to another drug by an we can say advice by a diabetologist or a physician. So that may be advisable.
I think you have answered the questions of our participants. Thank you so much for your patience and valuable suggestions, sir.
Okay, thank you.
Thank you. Thank you, ma'am and sir, for your valuable clarification. So now this is time for vote of thanks. So we can invite Dr. Jagadishwaran, Professor, Department of Pharmaceutical Analysis, to deliver the vote of thanks. Please, sir.
A warm good afternoon to all. It's my privilege to propose a vote of thanks. My sincere thanks to the management, Sri Nandha Educational Trust, for providing the facilities and encouragement for this national webinar. I may like to express my gratitude to our resource person, Dr. R.VADIVELAN, Department of Pharmacology, JSS College of Pharmacy, OOTY, for spending his valuable time with us in his busy schedule. We are really enlightened with your knowledge and presence. Thank you, sir.
Thank you.
I would like to thank our principal, Dr. T. Shivakumar, for his enthusiastic support and proper guidance. Thank you, sir. I also thank to our Chief Administrative Officer, Dr. K. Krishnamurthy, for his moral support and coordination. Thank you, sir. Our heartfelt thanks to the participants from various departments in and around the country. Last but not least, I thank to the organizing committee members for their technical support and guidance. Thank you, one and all.
Thank one and all. Madam, I think we can close the session.
Yeah, sir. Yeah, this is the conclusion speech, sir.
Thank you.
So thank you so much, and thank you, Jagadishwaran sir, for giving a kind gratitude to each and everyone. And the delegates are also very eager to fill their feedback form to get their e-certificate. So the announcement is there. We already sent the feedback link to your mail in yesterday mail itself. In that Zoom link, no, along with that feedback link is also there. Kindly check it over. It can be active after the session. Within a seconds, I will be activated. And I express my appreciation to all of our delegates for their patient listening and cooperation towards the session. And I would like to inform you that, sir, Dr. Vadivelan, sir, actually, the today's session, we reached the maximum number of delegates, sir. We feel very proud to announce that.
Okay,
sir.
thank you, thank you.
And 1,500 registrations, more than that, we reached. Okay, sir.
Okay, very nice.
Thank you so much, sir.
Thank
And for the delegates, this session is exist in our YouTube Nandha TV channel. You can go and like it and subscribe to watch forever for the further reference for your career. And thank you one and all. Bye. Take care. We will meet you in another session shortly. Thank you. Thanks a lot.
Bye.